They say that childbirth is like the trippiest thing, one of the trippiest things you can experience as a human. Which brings me to you. You're our first midwife on the podcast. I'm very interested in your journey and what you do.
Okay. Well, my journey on how I got to midwifery.
Yeah.
Okay. So how it started for me was 1997. I was graduating from UCLA, and I was in a kind of a inquiry as to what the fuck am I going to do with my life. And I actually had a little stint as a fugitive out in Canada. I ran away. I was involved in a medical marijuana grow as I was graduating from college, and it was really a very cool endeavor. It was shortly after Prop 215, where medical marijuana was legalized, although there was really no statutes for how many plants, and it was there was a lot of gray. And I was working with somebody who was also working with Jack Herrera and Peter McWilliams and Todd McCormick, and I was loved this great experience because I got to be around really some great thinkers, and it was such a fun kind of early 20s. I was young and kind of lived my life from the place of my heart, and somehow got connected to these interesting people in the industry. But it was eventually raided by the feds, and I was like a little pawn in this experience. And later on, I didn't get indicted, and a couple months later, the federal government contacted my attorney, and he's like, "Hey, where's your client?" And my attorney recommended we leave the area, leave the country, and I did. I went to Canada and had a great experience up there, and eventually it was time to come home and revisit that whole experience. However, as this was all kind of many years into court-related issues, I actually was in a very deep spiritual inquiry as to what am I going to do with my life. And it was really important to me to be in the healing arts. It was important to me to be involved in a sacred process of life. So healing, support, seva, service, anything that at the end of my life on this planet, I could say that was meaningful. I did a good job, and I'm proud of the work I did. It was not enough for me to be behind a desk, and there's nothing wrong with that if that's what feels right. It just wasn't right for me. I wanted to be making a difference. I wanted to be helping evolve the planet in some way, which ultimately meant I had to evolve myself.
What age was that?
Around 97, 98. So I was in prayer, a lot of asking God for the signs, like, show me the way. And it was a daily practice of offering myself over to Spirit. And a friend handed me a book. It's The Red Tent by a woman named Anita Diamante. And it's a biblical period fiction piece. And it followed this family. And in this family, there were births. And each birth, I was just sobbing. I was like, this is so beautiful. And I was like, oh my God, this is it. Midwifery. It was like the light bulb went off. And I immediately researched schools and the ways of becoming a midwife in California. And I wasn't interested in going back to school. I just felt like I got out of UCLA, and it took me 5 years. So I wasn't like ready to go back and become a nurse, which was one path. I became interested in the path called licensed midwifery. So I'm licensed by the California Medical Board. You can also be licensed by the Nursing Board. And then also there are other avenues of identifying as a midwife, and that's more people who are considered lay midwives who, that was the original midwifery before there was licensure. And it's become a bit more popular now, I would say, than it was about 20 years ago. And a lot of midwives who are not licensed, so people who are choosing to serve women without the bureaucratic licensure. Like when you have a license, I'm licensed by a medical board. There are things I can do. There are things I can't do according to my license. But women who are choosing not to become licensed but still want to support women in childbirth don't have those kinds of laws that they have to practice under. So I became a licensed midwife. I was trained in a very high volume birth center, and there was a midwife who was a priestess. There was a midwife who was like an NLP person, and there were all these really interesting midwives that I got to learn from, and I was able to kind of figure out who I was inside of this art of practicing midwifery.
What kind of midwife would you say you are?
Ooh. I'm a little of all the people that came before me, but for me, it's always about the sacred. It's about empowering women. It's about choice. It's about being informed of your options. I see birth as being an extremely transformational moment. And I think the pregnancy leading up to that moment, if women enter it consciously, or if they choose to educate and inform themselves, or really like do the work, right? Like stuff comes up in pregnancy, stuff comes up to be looked at and to be cleaned out, right? Like a huge opportunity to clean house when you're pregnant, because you don't have the bandwidth for the intolerable, right? The things that are confronting, the emotional shit, the traumas from previous experiences in this body. Like this is a window that's ripe for picking. And I like to work with couples who want to do the work, who really want to do the deeper dive and, clean house, pull the weeds, and then you can just have a baby, right? Then you don't have to bring all that shit with you into the birth or postpartum, like the unresolved complications. Like there's not a single thing, like having a baby does not simplify our lives. But if we can do the work before the child comes, the whole experience of parenting and birth becomes so much smoother. It's like, like you can go into life consciously and having already had an experience of diving through some big waves and coming out the other side, or you can go into this experience, feel threatened by things and afraid of our own decision making, and you can bring being a victim into your birth. You can bring that into being a parent, and those things really are power sucks. They become places where we start to look outside of ourselves for the answer when the answer is always inside.
Were you a home birth?
I tried. I did. Oh, like me, myself?
Yes.
Hell no. No, actually, what's really interesting, my mother had me induced on my due date. I was the second. She did not want to pay for 2 nights in the hospital. So she induced me on my due date, and, But here's what's so interesting. So there's this whole field called pre and perinatal psychology and health, APA. It's the Association for Pre and Perinatal Psychology and Health. And they have anthropologists, sociologists, doctors, midwives, nurses, all kinds of people within the medical field who've been studying birth for 40 years. And there's so many interesting nuances about how the conception, the pregnancy, and the birth went and how it informs who we are as individuals on the planet today. And so as an induced child, actually, let me take one step back. So my mother had been pregnant right before she conceived me, and she had an abortion. And so I was conceived shortly after that into a womb that had already been evacuated. So as somebody embodies inside of that space, there's like this fear of being found out. So I have this like interesting pattern of like being discovered, right? It's the fear of being seen. Because if you go back to the fetal experience, when my mom found out she was pregnant, there was disappointment, there was sadness because she didn't want to be pregnant. And there's a threat, like, will I survive this? Because the environment was just aborted. So, and then I was induced, so I was evicted. So there's this energy of like, don't fucking rush me. Like, I'm not done, I'm not, So those influences come from these early fetal experiences. And there's so many other interesting, like if you delve at all into this field of research, it's phenomenal. People's stories, and then how they go through life dealing with these kind of interesting attributes.
Can you talk about your birth? You giving birth?
Sure. So I was pregnant. I got pregnant, actually.
Were you at this point a midwife?
Mm-hmm.
Okay.
Yeah, for probably, let's see, 2000. I was licensed for about 4 years when I got pregnant with my daughter. So I'd seen some shit by that point. And I was very big, very fast. Like my belly was growing much faster than it probably should have been. And like I immediately went to clinician in my brain. I'm like, what's going on? Is it twins? Is there fibroids? What's actually growing inside me? And I had an ultrasound, and she's like, "Oh, you have fibroids." And I was like, "Oh, I did not know this." They are.
What is fibroids?
They are benign tumors that are estrogenic in nature, and with the excess blood flow that happens in pregnancy and the excess estrogen, they grow along with the baby. So I had like a 14 centimeter fibroid and a 6 centimeter fibroid and another 4 centimeter fibroid. So basically I was growing like I was growing twins. So along with the growth of my daughter, there was this other masses growing. And so kind of put me a little bit higher risk in the pregnancy because you can possibly like have a fibroid block the uterine opening. The cervix might not dilate. You can hemorrhage more. Like there's a lot of more potential complications with that. And it was just uncomfortable, right? Like getting pregnant anyway is uncomfortable, but getting big like you have twins is very uncomfortable because your body's growing at a rate that's so fast that your body, it's like you can't quite catch up with it. And so I never knew if I was going to be have a vaginal birth. I wasn't sure if home birth was really an option. It was kind of like we'll see how this goes. And so my actual labor was very long simply because my daughter was wedged in a position that really didn't accommodate descent. So she couldn't really drop deep into the pelvis. And so when I went into labor, which was a bit early, which is also a little unusual for a first-time baby, I had to, like, it was just going on and on and on and on. It was just exhausting, and I couldn't keep any liquids down and couldn't eat, and I just was getting very dehydrated and exhausted. And eventually, after 2.5 days of labor, I was like, give me the keys. I will drive to the hospital. I'm fucking done. I was done. And I really needed an IV. And I was so dehydrated. And I remember like going to my midwife. I'm like, I think I need an IV. She's like, you just need to relax. And I'm like, okay. And I got caught up being a good patient instead of actually like really listening to what I needed. And it's really important when a woman is in labor and says, I need this, or I feel this, having this experience, which for me was traumatic, which is like trying to advocate for myself and being told I was something else. It's so important for me that when a client of mine says, I feel this or I feel that, I'm like, yeah, you do. Let's get you what you need. It makes me a better advocate because of the experience I went through. And so, I feel it's very important to validate somebody's experience. Otherwise, you will walk away with trauma. And, you could have what looks like the most amazing birth, and women are like, actually, I'm hung up on this issue. And the issue was that they were not respected, or they weren't touched with consent, or they like felt like their power was in some way or another taken from them. And that stays with us, like it's one thing. You can have an incredibly empowering and conscious cesarean or belly birth and have a very traumatic, what looks like on the outside, beautiful vaginal birth. And, it's how you were heard, how you were spoken to, if you were acknowledged, if you were dismissed. These things really stay with us for our whole lives. But anyway, Juno, which is her name, was born vaginally in a hospital. And I have great gratitude for epidurals when, they're needed. And I definitely needed that. And, I'm very lucky. I had a great hospital experience, having advocates with me, having a doula, having a midwife in the hospital advocating for me made all the difference. The things, I couldn't get those things at home. I had to go to the hospital to get them.
When somebody is listening, well, we had a very traditional birth and a home birth, and it was like day and night for me, at least the watcher, because I'm not pregnant, and it's hard to know what women go through. But at least from the outside, it was a very sterile. Well, my wife got induced falsely because her liquids were too low, which now we found out that through an ultrasound is not even really detectable. And then she got induced, and it was so strong, the medication, that she was in crazy pain. Then she got an epidural, and then she gave birth. Compared to the second birth, where it was 2 hours of home birth, and it was the most beautiful, sacred, magical, trippy experience. It was very different.
You didn't need to microdose that day, did you?
I mean, it was intense, and it was just crazy to these two different experiences, very different. I wonder, watching Netflix and growing up, I've always seen births in hospitals. I had nobody ever talk about home births. We didn't even really know it was an option. My wife always had this like intuition that she want to do that, but we never got taught that there is this option. And I feel like there's this missing education on, let's just plan a C-section, let's just go for the epidural right away, where I think it takes the power away from women.
Oh, yeah.
And it becomes a business.
Yep.
Where the C-section seems to be like the end goal on a profit side. Do you feel that way?
Oh, yeah. Well, where are you from?
Austria.
So there's midwives in Austria.
Yes.
The whole EU uses midwifery generally for most low-risk women. So culturally speaking, midwifery is more acceptable in the EU. Where out here, where we have privatized hospitals, hospitals can charge $50,000-$60,000 for a belly birth, for a C-section, whereas a vaginal birth doesn't pay nearly that much through insurance. So they are motivated by how they make more money. It does become a business. Whereas you have a hospital here like Kaiser, and they pay for all procedures. It's like pulling teeth to be able to get actual like blood tests that you want to get. You simply can only get what the OB or the midwife recommends. They have to have like legitimize their coding in order for you to get things that you want to get, right? So yeah, where you have socialized medicine, typically you see fewer C-sections.
Do you have an idea of how many births would really need the hospital compared to how many end up in hospital because your OB tells you to?
Well, I can tell you that the National Institute of Health, which is worldwide, says you shouldn't have more than 15% of your mamas having C-sections. So that the surgical birth delivery rate should be 15% or lower. And I think in this country, it's in the 30%, somewhere 30 to 33%. And you have countries like Mexico, I think it's 60 to 70%. Brazil is even higher. I think Iran is in 90%. Like it's, you can see all around the world. It varies greatly. But I'm not sure what the EU statistics are on that. I can tell you that as a home birth midwifery practice, and we deal with low-risk women, so that needs to be factored in statistically, but we have about a 10% first-time mom belly birth rate.
Do you believe in high risk? Because I've seen twins being home birthed. I've seen diabetic women home birth. I've seen everything like on Instagram.
I believe they're absolutely high risk for sure. Like women who have heart disease, seizure disorders, high blood pressure, for sure. There is definitely high risk that exists out there. Do I think twins are high risk? It really depends on the provider. It depends on the health of the mother. Yeah. I don't think it's a one size fits all. We have to go deeper. You can't look at it in two-dimensional and say, what is right for everybody who has twins. There's so many other factors. But I believe that where people believe they are safest is probably true. I think we have instinct and intuition in that way. I think that the quality of care that we're getting makes a big difference, I think demographically it's really important as well. Like we have very poor statistics in maternal and fetal mortality among women of color in this country, and that goes beyond demographic, or beyond, financial demographic. It just it's important to talk about because women of color are not listened to. It's a very big issue here. So does that make them high risk because of their skin color? No, but it does make them higher risk because nobody's listening to them. We need to change that. We need to make sure that there are people who are of color to take care of women of color so that they feel heard and seen and witnessed. So I do believe risk does exist. It's like saying if you eat well, you're going to have a lower risk of hemorrhage. And if you eat shit, you're going to have a much higher risk of bleeding, among other issues. Low birth weight, smoking, lower birth rate babies. Like these are things that are accurate. So it's not a one size fits all, though. We have to individualize the experience and take into account all the other factors. But can a woman who's got twins birth naturally at home? Absolutely. I've seen it. And it's not just true because I've seen it. I mean, it's actually for sure. I recently heard about a triplet triplet birth at home. Mm-hmm. Like that would never even be considered in the hospital. But it was done and everyone had a great outcome. Is there risks associated with it? Absolutely. Absolutely. In the past, it hasn't always turned out so good.
When you grew up, did you consider home birth as being unsafe? And did that change with time? Or
It wasn't even on my radar.
Okay.
Like when I was a kid growing up, I wasn't thinking home birth, hospital. Like I wasn't even aware of that. I mean, when you think about exposure, there's only like 1.4% of women are birthing out of the hospital in this country every year. It's a big number, but it's not a large percentage. And it certainly wasn't in my field of reference. I didn't even think about it. I think like many young girls, I was like, I hope to get married and have a baby one day, but it wasn't like the where or the how wasn't really on my, in my periphery at all.
How would you explain, like a young woman growing up, how could you make her feel safer about home birth? What do they need to hear or?
Well, we're very lucky to have social media right now, sharing lots of imagery and birth experience. But I would say what really needs to happen is that we have to go back to like health class in our schools. And before we're talking about birth, we should be talking about our bodies, right? We should help young girls understand the reproductive cycle, teach them about what their bodies need at different stages of the reproductive cycle and how to best support them thriving and being connected to their own bodies and to their own health. If we can start with that, then I think we can start to also have some kind of sovereignty over our fertility rather than just taking the pill or some other hormonal contraception. Women can start tracking their cycles, understand their fertile windows, and practice safe sex that way, right? I think we have to start there. Birth is like putting the cart before the horse. It's like you can't expect somebody who knows absolutely nothing about their bodies to then be like, yeah, let's do this home birth thing. Like you got to start like creating a healthy foundation of knowing thyself first, right? And then once you have that, then you can make choices that support your vitality and your health. I just, again, don't think that's very accessible for young kids right now. I think I have a daughter, she's 14. She lives with me, I'm very health conscious. And, like I still find candy wrappers and all this shit. And like she chews aspartame gum, which I refuse to buy for her. But I can only they say you could take a horse to water, but you can't make them drink. I have to trust that she's eating enough of the meat stock and the high collagen foods and the pate and the liver that it's going to help her in some way. And ultimately, she has to come to drink the water. Like right now, she's sick. She's had her third virus in 6 weeks. She's like, what the fuck? Okay, Mom, I'm not going to eat any more sugar because she is now seeing what's depressing her body, right? Like we also recently did allergy tests because she was getting hives. And I love eggs. I've been feeding her eggs her whole life. She's highly allergic. And it's like, wow, like she's learning more about her body. And we're doing it together, really. But I think that's the most important place to start is young. Teach them. And then we can talk about birth. And right now, because of social media, you can access anything. You can see anything. You can access anything. When I was growing up, there were no Instagram births. Now you see lots of births of all kinds of animals, right? Like this stuff is very accessible now. And I think I'm hopeful that simply having these images and videos and clips, which are very short, right? That they will help seed a curiosity with a younger generation.
Can you tell me some do's and don'ts? I'd be very interested what to do, what not to do.
Okay, don't snort crack. Do not shoot up heroin. These are bad things. Try and avoid alcohol. What are my don'ts? Oh, don't dye your hair. Stay out of the nail salon.
Good one.
Don't burn incense.
Yeah.
A lot of people don't want to hear that.
And freaking candles.
Candles and Glade air fresheners and the scented trash bags and toxic home cleaning products. And like construction on your house. I can't tell you how many of my clients either move or take down a wall or something. Here's the problem. Like construction has all kinds of plastics and talc and all kinds of like really teratogenic substances. Same with incense. Has benzene, heavy metals. Like you just don't want to breathe these particles in. For a lot of clients of mine who do burn incense, the placentas are gray. They look like the mom's a smoker or somebody's smoking in the household. Don't smoke. Did I say that one? Mm-hmm. Try just not to do that. What else? Those are my big don'ts. And in terms of, I didn't say don't eat sushi or don't eat raw dairy. Actually, there's entire countries in the world who eat sushi and they seem to be okay. Raw dairy, if you go back and look at Weston Price's research, you will see that unpasteurized dairy is excellent in building a dental palate that has room for all your teeth. I try and avoid white sugar. That's also on my don't list. White flour, white sugar. Stay away from the whites. Cocaine, white flour, white sugar. Those are really not going to serve the development of the baby. We have really good data from the 20s that shows that when women are eating a whole foods diet that is inclusive of raw animal fats like butter or raw dairy and really good quality animal fat that is pasteurized, like all the things that you wouldn't think are healthy, like tallow and lard, and I'm a big fan of duck fat, and that we see really nice open palates, nice wide pelvises, really healthy teeth coming in the next generation. On my yes list, sunshine, right? I think it's really important to develop a relationship with the sun. I think that's really important for our children. You see kids at the park wearing like sunscreen that makes them look like Casper the Ghost. They're wearing their sun hats and their sun shirts and extremely low vitamin D levels, probably because they're not getting any sun and they're not eating a whole animal fat diet, which is going to affect immune system, mood, bone development, growth development, hormones. I think we really need the vitamin D found in animal fat and in the sun. And I always tell my moms with, their babies, I tell dads, like, make it a baby rotisserie and put your baby outside in the sun and base them in the sunlight throughout the day, 1 minute each side, and help them develop a relationship with the sun. The sun is our star. Like we need this for our immune system. We need this just like the plants and the trees need the sun. And without it, our health will deteriorate and we're not going to get the nutrients we need that come from the sun.
Does your daughter have a phone?
She does.
She does?
Yeah. But you have to understand, I'm a single mom and a midwife. I need to get a hold of that kid, and I need her to know that she can get a hold of me too. But she does not have social media. She simply has a way to stay connected with her friends. And I actually feel like for her, she's 12. She's going to this very alternative hippie school in Topanga called Manzanita. It's amazing. They eat literally farm-to-table food every day. It's all like grass-fed meats, and it's really beautiful. You should check it out. Beyond the food, it's on this open campus up in Topanga, and she's outside working in compost and weeding and doing seva on the land. It's really a wonderful, wonderful school. But for me, she has a dad that lives out of state, and she spends a lot of time there with him in the summertime. And I wanted her to be able to stay connected to a social group. And the phone is really the best way for her to have that. Plus, it gives her privacy, builds confidence. I mean, for her, I can't speak for other kids. We don't do screen time during the week. She simply has a way to access me, and I have a way to access her.
So do you watch TV?
No, I don't have a TV.
Okay.
Haven't had a TV for like 20 years. Don't miss it. And also not completely like contemporary either. Like I'm just not sure what's going on in the world. Like if it doesn't like, again, I do use Instagram to kind of to get some tidbits of what's happening in the world, but I am not that clued in, as my daughter would say. But I don't know if she is either, to be honest.
There's some new statistics that show that in America, the number one core, it used to be the top three, that medication is the third cause of death, the biggest. It used to be cancer and heart disease first and then medication, and now it turned into number one cause of death is medication in America. What do you think about that? Like, it's making more people sick than it helps.
Medication?
Yes.
Oh, yeah. That's not new.
Yeah.
Like, I don't think that's a new...
Well, new to me.
Is it? Oh,
Yeah.
well, welcome.
I grew up thinking, I don't know, medication is here to help me. Hospitals are here to protect me, and the whole medical system is built to support me.
And now?
And now I don't.
And so who supports you?
Well, I'm guiding my way through figuring out. I guess, I don't know. It's nature, it's spirit, it's myself. It's intuition. If you really listen in deep inside of you, you'll kind of know what's good for you and what's not. You know what you eat, if it makes you feel good or not. If you really open up to that. Like, I know how good it feels to go out in the sun, and every time a doctor is like, don't go in the sun, I'm like, but it makes me feel so good. Like, why are you saying this, right? Until I understood there's this huge narrative to get our vitamin D down, because it's the ultimate immune boost, and it would have also helped us a lot with COVID. So there's this huge narrative that doctors have been pushing since years, that the sun is bad for you. And now they came out with these chemical creams so you can stay longer in the sun. And since also, like, I guess since becoming a dad, the whole narrative has shifted, because now I'm responsible for somebody else. When you're young, you just eat shit and you live shit and you don't give a fuck, because you're like, you want to have fun. But then once you're responsible for an innocent human being, you have to approach everything differently, because he doesn't know.
Yeah.
And you have to protect him at all costs.
Yeah.
And I think what's really also this other narrative of not having children, or having little children, and not creating family, and this like attack on family in America makes a lot of sense to me, because then your consciousness does not shift and you stay in this victimized mentality where it's all me, my career, my problems, my mental health. Listen to me. When becoming a dad, it doesn't matter how I feel. I have to protect my family. I have to make sure everybody eats good, everybody is healthy. It's not about like me.
It was an inside job.
Yes.
Yeah, you had to figure it out for yourself. And it's individual, right? Like, what's really right for you probably isn't right for Jocelyn. You know, she's got to figure out her own answers, right? So that's taking your power back. That's saying, okay, I'm sovereign here, and I'm going to own my own agency and make the choices that are right for me. And, you know, it takes a deeper dive to do that, you know, but that's ultimately where you got your power back and your health, right?
Absolutely.
Yeah.
Is there more things where you stay away from? Like you said, the pill is a no, right?
The birth control pill?
Yes.
I think that everybody should read the book Sweetening the Pill by Holly Grigg Sproul. Or you can watch Ricky Lake's movie, The Business of Birth Control, which is based roughly on the data from that book. I think it's extremely important that people who are of reproductive age have access to this information so that they can make choices for themselves. I think the pill might be appropriate for some people, and they just need to figure out for themselves with all the data, right? It's true informed consent. We're not getting it from our obstetricians and gynecologists, okay? We need to do the research on our own. Because I know lots of OBs are like, it's fine, just take it. Let me prescribe it for you. Oh, that one didn't work. Let's do another one. But we're not really looking at what the side effects are. Yaz was a very popular pill that for many women created blood clots, which of course now made them high risk or they died or, but they still prescribe it. It's still available. It's just, you don't know if it's right for you and you don't really necessarily know the long-term side effects. So would I take the pill? Hell no. No. Luckily that's not an issue anymore, but I still think the power is in understanding your reproductive cycle. And if it's fucked up, then the power is in fixing it by changing your diet, your lifestyle, getting in the sun, eating the right fats. We are having so many issues with reproductive health, right? Like PCOS, endometriosis. These are terrible, but of course, in the medical system, they'll just give you another drug to mask those symptoms. And then you take another drug to mask those symptoms. And again, these drugs can be helpful for some people, but the real power is taking your health back.
For who would it be? Who would
benefit?
Pill, who would benefit from the pill? Like to not make a baby? Or is there's no other benefit to it, no?
I would say some people with severe endometriosis, it could be very helpful for a period of time. That kind of pain is crippling, and so, would it be better to be on something that regulated a menstrual cycle, or you don't have one for a period of time until you were in a position that you could take control of your health? That's possible. For, being a health crusader, which I believe you are, it's a luxury of time, of money, resources, access, really good food, access to information. That is not necessarily available for everybody, So, that's just one demographic that I think would benefit. I think also for people who, I don't know, we could try and pick out all the people. I don't think you can take it off the table. And I will tell you, the women's lib movement would lose their shit, because during the time of women's empowerment in the 70s, where I think the pill came out, the pill was a big part of this, because women were no longer subject to pregnancy. And for them, it was getting their power back by saying, we're taking back our own reproductive timing.
But it was a trick.
Well, it wasn't. They didn't know all the problems that were associated with it. They just saw it as the path to power and the path to sovereignty and agency over their bodies. You can't take that away. It's like part of the foundation of the whole women's lib movement is saying we're taking back our reproductive power. I think that it has a purpose. Is it still the best way to control pregnancy? I don't believe so. But I don't think we can say one size fits all. I think we need to educate people. I think before doctors prescribe hormonal contraception, the patient should be required to read a book that they sign, that they understand the risks associated with it.
What about vaccines?
Are we going there?
We might have to.
Haven't you gone there before?
A little bit. I had Bobby Kennedy's cousin on. She's very against vaccines. What would you say?
I can see their purpose in certain parts of the world. I can see that it's not a one-size-fits-all. I think certain vaccines for certain at-risk populations make a lot of sense. I think that to say that they don't have any risks associated with them is a bold-faced lie, and there's a lot of data to back that up. I think that we have to, if we're really going to sit and have a conversation about vaccines, it can't be a yes or no conversation. It can't be like, yes, they're amazing and we should trust them, and no, all vaccines are bad. I don't think that's going to get us anywhere. I think we've been having that conversation and we're at a stalemate. I think we need to take it one vaccine at a time. We have, again, just like individualizing care, we have to take it one person at a time, one immune system at a time. You know, each child at 6 months of age is very different from the other. You know, if you look at the kids who have the most reactions from vaccines, they are the ones who weren't breastfed. They're the ones who were born through C-section. They were the ones who had antibiotics in labor. You know, those risk factors make somebody a higher risk patient for having some kind of bad reaction. So I'm not willing to take the stand, they're horrible or they're fucking great. I think we need to individualize our care much better than we're doing. And I think parents need to be much better informed than they are. And that means they have to educate themselves. There are lots of documentaries out there, many who have been hidden from view, but they exist. And I think that to trust your doctor blindly, they don't have all the information. And they just regurgitate what they were taught in medical school. So I don't think that's, if you're putting your trust and faith in somebody outside of you to make the decisions for your health or your child's health, then you're missing lots of opportunity to be in charge of your own well-being. You know, I don't know if you're too young for this, but they used to tell women that smoking was fine in pregnancy. Right? They've given women all kinds of medications thinking, yeah, it'll be fine. And it wasn't fine, you know? And it caused a lot of problems in the past. So if we're looking for the truth, we have to do the research ourselves. And the information is out there.
Are you still on this journey where just lots of times where you do find out that your opinion was wrong about things? And where do you go for information?
I'm always right. No, that's not true. Do I find that I've been wrong about things in the past? Yes. Yeah, for sure. And where do I go for information?
Yeah. Like when you do your research, it seems to be very hidden and hard to trust anyone. And it's always like if I want to find out about vaccines, as an example, it seems to be very hidden because all the advertisers on all the big platforms are backed by pharma. Mm-hmm. So if YouTube, Google, if they all take money from big pharma and somebody would talk maybe critical about it, it will be not in their interest to promote that or even show that to people. So if Bobby talks about vaccines, you'll have to like specifically look for him. And like when I listened to him on Joe Rogan, I guess for me it was the first time that somebody ever talked about vaccines in a critical aspect, and not like just to bash them, just more like showing research. Showing studies and being not like it's safe. Mm-hmm. And that was the first time for me that I was facing somebody questioning pharma.
And that was a couple of years ago, really, right?
Yeah.
Well, yeah. Uh-huh. So I am in the field of pediatric health and maternity care. So I have access to alternative and holistic pediatricians, and that's always been interesting to me because of the field I'm in and my own interest in health and well-being. So of the people that were questioning the vaccine schedule, I listened to them because it wasn't all or nothing. It was, let's have a more conscious approach and let's individualize the client and let's individualize the need. Right, we have to do that. One size fits all is, it's like a blanket, and you're trying to cover the broadest amount of the population. But when you really break it down, we're all so different. We all have different health issues, and that needs to be taken into consideration. But I would say, like, look to the people who are in the middle, right? Like we all can find people that agree with our point of view. They exist. And the more extreme you are on one side or the other, you're so polarizing. And it's not appropriate for the kind of, at least for me, I'm interested in not being so extreme in my life. I don't find that serves my health. Just like extreme diets, I don't really subscribe to that anymore. I mean, there have been times in my life where I was vegan or raw foodist or, paleo. Like, I don't do well with extremes. They're not sustainable. And I end up having more problems after the thing. And it's not really, it's not sustainable. I'm looking for what is sustainable. And that's an individual thing. I think when people travel a lot, those kids are going to be exposed to a lot more things. I think kids in daycare are exposed to a lot more things. If you are, somebody who's going to be at home with your kids and breastfeeding, and, I think a delayed schedule is absolutely fine. And delayed could be 5 years. It could be 10 years. I don't know. I think it really depends on the environment that the individual is in and what is their health. One thing that's true with all kids who have autism is they have shit guts. They have leaky gut, which means they are, whatever they eat food, it's passing through the gut lining and it's going into their bloodstream and it's causing inflammation of the brain. When you have that, you're going to be sensitive to a lot of things, including vaccines. Vaccines have a lot of teratogenic substances that if you're not able to shit those things out of your body, they're going to go into the bloodstream and they're going to affect you. So, we have to be more careful with some kids than others. Some kids do fine with vaccines, some kids do not. And that's not my opinion. That's just the reality.
Are there certain things where you would be like, for young parents or upcoming parents, where you're like, here needs to be research done? Before you give your daughter the pill, you need to do your research. Before you give antibiotics, you should do some research. Before you plan your C-section, before you put the eye cream on your baby, before your early clamp, maybe you should look into that.
I think you said all of them. Before you have sex, you should do your research. Before you drink water, you should do your research, right? All the things. I think.
And it becomes overwhelming almost, no? Where you're like, oh my God, everything, the more I'm on my holistic journey, now I'm kind of fine because I do this podcast. I have very interesting people to talk to. It gives me more of a grasp of how people live. And like you said, you see people very far drinking their urine and selling their yonis. And you find what works for you on this constant path of finding out. But in the beginning, you're like, oh my God, everything harms you because everything is polyester. They fly with airplanes over the sky, shooting chemicals down. Netflix is propaganda. Every music is about drinking alcohol and being degenerate. And it's very overwhelming.
Yeah. Were you ever degenerate in your life?
Oh, yeah.
Yeah. Me too.
I still catch myself being or wanting to be degenerate.
Yeah. I mean, you pay for it now, though. Look, I don't think it's about being perfect. I think that we're all just hopefully doing the best we can. I'm interested in living a life of understanding, but not extremism. And for people who don't give a shit, they're happy being ignorant and they're fine. Literally, they're fine, right? It's when you start questioning. And I hope I never stop questioning. I hope I'm always looking for the answer. But how fucking down the rabbit hole do you want to go? You'll end up moving to the top of a mountain and never talking to somebody again. You can't escape the human experience. This is actually where I'm at right now in my life. I think that I've had enough spiritual exposure, where I'm what's the divine experience? I want to align with the divine. That's been my goal my whole last 25 years. And the truth is, I think I've bypassed so much of the human shit. like the discomfort and, just literally just feeling human feelings instead of like being, it's like how it's supposed to be and trust the process. And there's this whole other somatic approach of feel the discomfort along the way. And the more you're willing to feel the shit, like really face it and feel it and look at the shadow, on the other side of that, you're literally free. You truly are, it's like by not bypassing, you have access to the truth of the human experience, which is ultimately divine. I don't know. I'm like, this is where I'm at right now. It might change next week. I don't know. But right now it's about feeling the feelings and just being real with them. And, it's not about defending yourself or, it's literally about feeling what it is to be human. And you cannot escape it. You can't escape the fucking things they're spraying overhead or what's in your water. And you can make yourself crazy trying to avoid all the things, but it's never going to happen. You just look like a nut, And you become unapproachable in your extremism. Yeah, here's what I would say. Take the shit out of antioxidants. Eat healthy food. Make sure you're shitting. Make sure you're staying hydrated. Take minerals. Take probiotic-rich foods. Eat fermented foods. Eat animal fat. Eat the butter. And you know what? I have Hashimoto's. I've been so wheat avoidant for the last, I don't know how many years. Recently, got on the sourdough kick. I'm eating the sourdough. And my fucking thyroid antibodies have been lower than they've been in years. And so I think that like just recognizing my own extremism and how it hasn't served me. And I haven't enjoyed life as much as I'm enjoying it now, And I have to be careful of the sugar thing because I can, crack out a little bit. But I just love food. It's like my love language, both making it for other people and feeding people and eating it. So good. But the extremism is what's killing us. And whether that's extreme trust in your government or your parents or your mentors, it's like we gotta like take a bite out of that. Does it really feel like the truth for me? And I try on truths for a little while. I try them on. I'm like, is it? And if it really works for me, it stays. And if it, I can also evolve past my own historical truth. I'm willing to be wrong. I'm willing to be reborn. And right now I'm just being reborn as human. I just feel like this is a good place to be right now. And maybe, tomorrow I'll be reborn divine. I don't know. But right here, right now, this is what's working.
Does it still excite you to see birth?
You want to know what excites me? I love the moment when the woman finds it.
The baby?
No, not the baby, herself. Oh. When she finds it, when she, there's often a period in transition, which is that part of labor at like 7 centimeters. And it gets a little hairy sometimes. It gets a little feral. It gets a little messy. And it's like she's in that in-between place and there's no turning back, right? And this is where a lot of women want the epidural because it's like, oh no, if this is going to happen for another day, I cannot, right? But when she gets through that and then you get that look on her face where it's like, let's do this. It's like, yes, it's so great. I love that.
When she's in power.
Oh.
She feels...
It's like
what it means to be a woman.
Yeah. I mean, I can't say I think women are feeling that all the time in different phases of their life experience and pregnancy, and part of that is the vulnerability. But you understand, like when a woman is in labor, she is the most vulnerable of her life, right? Like it's so easy to give your power away to the doctor or to the nurse or the partner or whatever. Even the midwife, like I'm not interested in her power. I'm interested in witnessing her take her power. That's what I get off on. That to me is the fucking...
But when you're at
Yeah.
home, there's no escape. I feel like, because like you said, like I know a lot of women that when you have the epidural right there and they're like, take it, they take it. But when my wife was at home, now we're doing this. If you go, you'll give birth in the car. There is no, you're done. And I saw that shift. I saw where she's like, she went from being lost and hysteric and so much pain to, I'm in this now.
Yeah.
If this is the last thing I'll do it. Like we're getting this done.
That's poetic. That was very poetic.
And she did. She did. She did.
She did it.
Yeah.
That wasn't that fucking hot?
Yeah.
Yeah. Right?
No, but I knew it. I just wanted her to know it. And like I always knew, I don't know, I feel like women are born to give birth. She's born to give birth and she will give birth. I saw it always. But she didn't believe it until that moment where she shifts and then she's like, and then it happened.
It happened. But you couldn't do it for her, and all your wanting for her to do it didn't make it happen. It was when she did it. And that's what I like. I mean, I like birth in general.
Yeah. But there was no way out.
Well,
And as a partner, I had this moment where I'm like, fuck, like, I should have, like, if we were in the hospital now, there's options. But the best thing in life is when there's no options.
how about this? I'm going to give you a different reframe. Instead of it being no options, it's choosing what's in front of you. Because no options is like, you're fucking fucked. But if you have what the experience is and you choose it, there's a place of power there, right? I had a client once, and when we were at home, there was a couple heart decels, and I was like, I don't like this. We're going to the hospital. We got to the hospital, a few more decels, and then the baby tanked. This was like, I don't know, 2 hours after we got there. And the doctor went to the mom and said, your baby's in trouble. I really think, I think this kid needs some help. And the mom was like, let's do a C-section. They went in, she had a C-section. She was fucking so empowered. She got to choose the experience. Do you know what I mean? And that's what happened in that moment when your wife was losing her shit. She found it and she chose it. No matter what it felt like, she chose it. And that was the moment she took her power back. And that's the difference between somebody feeling traumatized from the experience. Like you could have a really fast birth. I have another example. Dear friend, water broke. This was like 20-something years ago. Her water broke and she started, I didn't hear from her. And I called and I was like, I'm just going to go over, just check in on them. She had already had the baby. It took first birth, maybe an hour of contractions, and the baby was here. She was on one side of the bed. The dad was on the other side of the bed holding the baby like, oh my God, what just happened? And she was so disconnected from her experience. And it wasn't something that she was in that moment able to choose. She felt like, what the fuck was that? I didn't sign up for this. Like, that was not at all my experience. Dad didn't even want to be in the room because he had his own birth trauma. But because of how the birth happened, which was so fast and out of control, there was a disconnect for her, right? Her next birth, very fast. But she was able to choose it instead of feeling like it happened to her. Right? And these are like nuances, but they mean so much. They have such a powerful imprint that they leave upon us.
I don't know.
You can have a difference of opinion.
Yeah. I just feel like you said, like when we're so vulnerable, the devil waits. And if there's an easy way to back out, we might weaken compared to when you're at home. I feel like there is this, I have to do it now.
It's not true.
No.
Here's why. We can always go. Like, we're not leaving women no options.
Yeah.
I labored at home for 2 days. I was like, it's time for me to go. And I knew it. It was like 6 centimeters for 12 hours. I was like, I am done. Like, I've exhausted all my resources in this space.
Yeah.
She had a 2-hour labor. You don't have a lot of time in a situation like that. And yeah, you're right. It could have been in a car. But hopefully her provider, her midwife, was looking at her going, you got this. You're right there. You're almost there. And having that kind of reassurance helped her keep her eye on the prize. But, babies fall out of vaginas all the time. Like, this is like, the design is such that no one needs to be there for this to work, right? We're biologically designed to give birth. That you can know intellectually, but physically, to be part of that force of energy, of movement of energy, is like surreal what it feels like. It is fucking crazy and amazing and crazy and amazing, right? It's got this spectrum of quality to it where any number of things we might have to tend to, right? Like her first birth, she had an epidural, right?
No.
Her first?
No epidural, just induced.
Oh,
no, epidural.
Yeah.
Epidural.
So
yes.
She was induced.
And epidural, yes.
And when things got intense, they gave her an epidural.
Yeah.
That's very common. It's very rare for a woman to get induced and not get an epidural.
Yeah.
Though that is some next level shit. Those women are fucking hiking Everest. It's insane. And I have immense respect, for people who can endure that, because you're missing a lot of the natural catecholamines of labor when it's an induction. It's really hard. It's really hard. It's like getting a full body tattoo in one sitting. It's next level.
But then once she had the epidural, it was hard for her to push because her legs she couldn't feel her legs, nothing. And then the cord was wrapped around the neck. And then baby's heartbeat started like dropping. And every time he would come out, I could see him come out and then go back in because it would pull him like back. So the head would come and go back in. She would push somehow and it would go back in. And then...
That's normal, by the way. Oh. No cord or cord.
Okay. But then the OB decided to use the suction cup, which was amazing, instead of saying like C-section or some other options.
Why the C-section? Oh, I'm sorry, why the vacuum?
Because it was just not... He was not coming out. I don't know. And also the heartbeat started slowing.
Okay.
Yeah.
So he was like, let's move things along.
Yeah, and she was also on her back.
Yeah.
I mean, the second birth was like standing, and it was like you said, the gravity she didn't even, there was no contraction. It just like came out like naturally, like by gravity, like just flopped out. But with the first baby, it was just, she was very uncomfortable. And she used a suction cup, and that did the trick. Yeah. And both was very, I mean, it's hard to not believe in higher powers when you see birth a human. The whole time, like the whole pregnancy, it's, I don't know, the whole ultrasound and everything, like you know something's in there, but you don't know until you see the little hair, the head sticking out. You're like, okay, there's actually someone in there. It just hits you different.
Yeah.
You don't know until you see it, and then you're like, oh, this is unbelievable.
Yeah.
How is this real?
Yeah.
Like, how can you grow a human being in your belly?
I know. It's wild.
Yeah.
Sometimes you grow 2.
Yeah.
Or 3. Yeah. It's all part of the mystery. I mean, science explains it, but still, if you're not blown away by it, then you're kind of sleeping. It's pretty wild.
That was nice.
Yeah. Yeah. How was her recovery after the second?
Well, that's another thing, I guess, which also is a huge change. With the first one, there was they also then, once the birth happened, they took him into this like glass container under this light, and he just lays there for some time, and there's this disconnect compared to him laying with her for hours, still with the cord and the placenta and everything. We left it for like 3 hours until we burned the cord, and it was just so beautiful that you don't have to go anywhere. You're in your home. And the connection between them two was very strong because she also spent then 2 weeks in bed. Yeah, we tried to stick to that.
That's hard with a toddler at home.
That's very hard. My mom was here to cook every day, but it was super hard.
Yeah.
And with the first one, I think she was up right away. Like after the 2 nights in the hospital, she was up and going, and we didn't know any better.
Yeah.
Yeah, she would like, I don't know, be on her feet, walk around. And there was more. It took a minute for them to bond and then to breastfeed, and then the bonding happened. But it was
Delayed. Yeah. That's normal.
Yeah.
Yeah.
And then, of course, they send us home.
With formula?
Yeah. No. With this crazy medication.
Oh.
Yeah.
The first one or the second?
The first one.
What kind of medication was your baby on?
No. For the mom.
Oh, for her?
Yeah.
Pain medication?
Pain medication.
Oh. She got some good drugs. Did she take them?
No.
Yeah.
But they said, don't be a hero, just take it.
That's I hate that. Don't be a hero, just take the epidural. We see that all the time. Yeah. I had a client recently in care, and she really wanted a home birth with her first, but her family was like, hell no. And she just like, succumbed to the pressure. And then I met her. She's like, I want a home birth with my second. I want to do it. And her family accused her of being selfish. Like, you're being selfish. And I really sat with that, how when it comes to our body, that other people feel like they have a say in what we want to do with our body. And the birth of our child, the point of time when we are at our most vulnerable, where we deserve the most amount of support, to be accused of being selfish for wanting it to be non-interventionist, not controlled, non-induced. We don't want somebody abusing us, which is obstetric abuse is rampant everywhere, every country. But I see, it's one of the reasons why I really could not work in the hospital setting. I just cannot. I really have a visceral experience, not all the time, but the misogyny and the abuse that happens in a hospital setting that women are now left with feeling, it's like, no, it's so hard. So hard to witness. I had a mom recently, and we did transport. She had a very long early phase of labor, and she had a history of abuse, and she really wanted and needed an epidural. And we ended up transporting to a hospital, and the doctor was this older Israeli man, so he must have been in his 70s. And he and I did not get along very well. And at one point, her baby's head is coming through, and I was like, put your hand there, feel his head. And the doctor slapped her hand away. He was like, that is not sterile. We will not be doing that. And he looked at me and he silenced me. He's like, there's only one captain in this room. I'm the leader. And I was like, oh my God, this is fuck no. This is a hard pass for me. I cannot be in this kind of environment. But I also am not here to abandon my clients, so I have to stay present, feeling the human experience, going back to that. And it's like that kind of control, that kind of misogyny is every hospital, every day, all around the world. This level of just abuse, abject abuse that is happening inside of the experience of birth. And we give our trust to our providers, right? It's like, I trust my doctor. We've heard that. That was, I think, the mantra of the whole COVID period. Trust your doctor, right? And as a result of trusting this other outside of ourselves, we end up having really challenging experiences, that we have to pick apart. But maybe, honestly, it's the process of giving away our power, experiencing the fallout of that experience, and then making a different choice for the rest of your life. Like I don't look at it necessarily as this bad thing that happened. It was the point in time by which we realized that we cannot give our power away to those outside of ourselves, that we must do that in our work, take it back, and be responsible for our own choices. It's heavy and it's hard, but it just evolves you so fast, right? Like after that, you're like, okay, won't be doing this anymore.
Exactly.
Yeah.
You slow it down a little bit and you're like, yeah, I will make that choice. I will not trust somebody else. And I guess with everything in life, you end up that in the end of the day, you have to always do what you believe is right for you. And I just feel like, yeah, maybe there is a new upcoming where we maybe losing trust in some thing or someone can be a beautiful thing where you take the power back.
Mm-hmm.
But especially with birth, I feel like the woman needs to take the power back.
Yeah.
Because in the end, it's her decision. It's her body, her baby.
Yeah. Yeah. I agree.
All right. Anything else you would tell a young pregnant woman or planning to create a family?
Well, I'm very big on preconception work. I don't think it's enough to just take the goalie away and get pregnant. I think that we're seeing a lot of miscarriages. We're seeing a lot of issues that we didn't see 25 years ago in birth, whether it's with development or midline defects. Like there were always tongue ties, but now we're seeing pretty excessive tongue ties and umbilical hernias and other midline defects. Some which aren't really that big a deal, some which are a very big deal. I would highly recommend people spend a year before conceiving and really lay some very solid foundations. It's one thing to stop drinking when you get pregnant, but it's another thing to stop drinking before you get pregnant. And I don't mean like the week before you get pregnant. I mean like really making some lifestyle choices that support the health and development of the baby and the ease of the pregnancy. So preconception work is definitely my jam. And I help people for 6 to 9 months beforehand. A year is optimal. More than a year, even better. Really replenishing your stores, supporting your vitality makes the conception easier, the pregnancy easier. For sure, the birth is easier. And the postpartum. So optimizing those things makes a big difference. I mean, metabolically speaking, pregnancy is brutal. It's really hard on the body. It ages us. It takes a lot. It takes about 3 pounds of minerals from our own body to make a human. Like that's significant. You can't just, swallow a pill for minerals. You really have to build those stores over a longer period of time. So that's definitely something that I would recommend to people, especially in the environment that we live in today. I think that's mission critical. I think it's, becoming a luxury to get pregnant on the first try. I think we're seeing huge declines in our fertility. We could do a whole podcast on that if you'd like. So I think, taking that into account, it's not enough to just freeze your fucking eggs. That's an idea, right? And I know a lot of women are doing it because they haven't necessarily found the right partner yet, and they just want to keep their options open. Okay, I get it. Relevant. And I think what's more relevant is the environment that we are conceiving our children in. And what can we do? What can we do? Where is their power? Where is their choice? And it's absolutely in recognizing that your body to conceive, grow, and birth a baby is a fucking temple. and it needs to be acknowledged as such and honored as such. And what you put into it, how you're feeding it, getting your vitality stores up is so important. Getting your energetics up. I mean, look, we are electric beings. We need to have a lot of minerals in our body to operate all the cell functions that are required of operating a human organism. So really working on that, working on our gut health. I'm a GAPS practitioner as well. I don't know. Do you know what GAPS is? So it was developed by Dr. Natasha Campbell McBride. It was designed to help her child heal from autism. And it's similar to FODMAP in the low allergens, but it really focuses on healing the gut lining. And
autism is directly connected to your gut?
Yes.
Because it's brain inflammation.
Yes.
Yes.
That's very simply stated,
yeah.
but very much so.
Mm-hmm.
Kids who are autistic, and, there's, of course, extremes, but
there's some sort of inflammation in the brain.
Yes.
And what controls your whole immune system and everything is mostly the gut.
Yeah. So the more you work on that before you conceive, the better inheritance your child's going to get from your microbiome, and the less likely that child will exhibit neurological issues, mental health issues, immune health issues, autoimmune issues. I did a very deep dive on the microbiome, and there are 3 huge components that influence the child's health for life, and that is vaginal birth, antibiotics in labor, and breastfed. So those 3 things impact like 60 health issues that we develop as an adult, including asthma, diabetes, obesity, all kinds of allergies, mental health, like autoimmune. It comes down to these 3 things. And again, you don't always have a choice with a C-section or vaginal birth, right? It's not about, you fucked up. It's about what can we do to repair these things, right? And I was teaching the class that your wife took, and there was a woman. She's like, "Oh my God, I was a C-section baby." She's like, "I was never breastfed." She's like, "I've had asthma." And she's overweight, and she's like, "This is
it.
Like she saw where it all came from.
Yeah,
it's not a mystery. Like the health crises that we face in contemporary society are not a mystery. It's not like, I don't know what's going on here. How are all these people so sick? It's because we are not inheriting healthy immune systems. Then we're getting childhood over-vaccinated, which I do think is what's happening. I think there's too many on weakened immune systems.
Yeah, and the babies are too weak to deal with the metals.
Yes.
Yeah. I mean, there's a difference between saying all vaccines are bad or we are too weak to be able to handle the side effects, maybe, of certain medications. Plus, I think it's not about shaming women, but I don't think people are aware of the importance of breastfeeding, of a vaginal birth, and they might choose the C-section because they just have been told so by other people. Mm-hmm. And then of course you have these options when there's no other way, but I've seen it too many times now where people just choose the planned C-section, choose the formula, and that is directly correlated with the health of the baby.
100%.
Yeah.
And the health of the child and the health of the adolescent and
the
health of the whole life.
Yeah. So it's vaginal birth, breastfeeding, and the amount of antibiotics through birth, or just in like labor. In life.
In labor.
In labor.
So remember, when a baby's born, I almost want to do this on the microphone. Right? They're sucking, inhaling, and swallowing all of the bacteria in the maternal microbiome. Yes. That is the initial seeding for life. If the mom is getting, if she has GBS, she's getting IV after IV of antibiotics.
Yes.
Her microbiome is being completely annihilated. So that child is not seeding vaginally, that's it. That's like when you're like getting your download for life on planet Earth. That's what we need. And what happens when we inhale, suck, and swallow all of the bacteria in the maternal biome is it gets into our throat and goes into our gut. And within a few days, our body's producing its own vitamin K, right, which inhibits hemorrhagic issues. And it's also like it's colonizing itself. And the cilia that's lining our gut lining is getting implanted with all the appropriate cells and bacteria, which help us absorb nutrients from our food. And then the little gut junctions are where these bacteria multiply, and they kind of slough off the like finger-like cilia that moves food down the GI pathway. And if we're not getting those probiotics or those bacteria in the microbiota into those gut junctions, they become leaky gut. So now they have holes in that very thin one-cell lining tissue. So this is the initiation of malabsorption and leaky gut, which is now also affecting the brain, inflammation of the brain.
So if you have a choice, do not have a C-section, do not use formula, and do not take antibiotics.
I mean, if you have a choice, yeah. And I think we need to address how we manage certain things. Like GBS is a big one, group beta strep. Have you heard of this?
No.
So most likely she did a culture in her vagina around 36 weeks, right? And they tested her to see if she was positive for this one strain of bacteria, which we have thousands, right? But we have taken this one strain of bacteria and made it pathogenic. Even though, like, she could have GBS today and it's not going to smell, it doesn't itch, there's no rash. It's just simply a bacteria in all of our microbiomes, right? Generally lives in our descending colon. And for some babies, this can create a problem in birth. It's generally when there's other risk factors present, but not always. And so what we've done is we've just given all women, this is Western society and some of the EU, we give every woman antibiotics in labor if they have this bacteria present, regardless of risk factors, when we know it is primarily in the presence of risk factors that it will create more of an issue. So now we have, 20 to 30% of the population getting antibiotics in labor. That's going to impact what the baby suck, swallow, and inhales at birth. You've already taken away not just this one bacteria, but all these other highly beneficial bacteria. And I think it's important that the medical system start to individualize the experience of each woman. Certainly give women the choice. And women aren't given the choice. They're just being told, this is what we're going to do. And the truth is, if you don't figure out what your choices are, you don't have any.
I know in the hospital they're very, they don't ask you anything. Mm-hmm. They just do.
They just tell
you.
And
they just take the baby and they just put the creams and all the things. Nobody ever asked if we wanted to, or even laid out the options or made us aware that you do have an option, that you can decide if you want the eye cream or not. And it's really interesting when you have to take a STD check when you only have one sex partner. I mean, they have all these very red flag things where you're like, wait a minute, what? What are you talking about, right? And yeah, I mean, it's crazy. It's almost like they take advantage of a very naive and first time mom, I would say.
Yep.
They definitely use, and also they do this whole fear. It's always this fear porn.
Fear porn.
Yeah, where they just they're like, I remember going to the OB the first time, and they're like, first time birth? No, you cannot do home birth. You can do it on the second one. And then we did the second one. They're like, no, it's not a good idea. and every time they are like, oh my God, like there's. I remember having this conversation where she's like, oh my, there's so high risk. She teared so much the first time. Like they tell you all these like wrong things that are not accurate, just to make you be like, oh, it might be safer. Like it's better for the baby. It's safer for me to go to the hospital when it's just better for their pocket.
Yeah.
I witnessed it firsthand.
Yeah.
The whole time, especially having one traditional birth and one holistic birth or a home birth. It's like it was like, it was crazy.
Yeah. Well, it's really the traditional birth is the home birth.
One more thing, the baby never lost weight.
In a home?
At home.
Oh, interesting.
When Rodeo was born, after being induced and coming out too early, even though my second son was like fully ready when he wanted to come out, when Rodeo was kind of like pushed out, and then also lost weight. Like I think lost 2 pounds, and it took a minute to even get back to that weight. With the home birth, never lost weight at all, and never turned yellow, never had jaundice, never cried. Just even the mentality was very different. Very no isolation, no separation from the parents. There was no moment where there's no skin to skin, or he was like washed somewhere with a nurse.
Yeah.
Yeah, made a huge difference.
Yeah, I'm sure.
Yeah. So would you say the allergies that your daughter is developing now might have to do with her birthing story?
I don't think so. I think that if I...
Or is it environmentally?
It's a good question.
Because
your
daughter,
I know,
who has the healthiest, it's always interesting to pick the people, right, that work in this field and is very aware of things. Like, how can your daughter possibly have an allergy?
Yeah, that kind of hubris gets you nowhere in life. I would say the things that I've been like, since we figured this out, which was about 2 weeks ago, I think that she's got some histamine in general. I think she's high histamine in her body. And so her body is more sensitive at this stage. So she'll be 15 in about a month. And she's also dealing with like really significant acne on her body. So I think her liver's probably congested and she probably needs to do a cleanse. Unfortunately, to get a 15-year-old on the cleanse bandwagon, it's hard for them to understand the reasons why. And also, like, I don't want to, like, I'm already such a, I think we're going to cleanse. It's like, I don't need to be on a diet, Mom. It's like, I think there's some challenges in the communication on that, because I just think there's a cognitive dissonance with a 14-year-old and how they would just want to be normal and eat what their friends are eating. And they're not trying to like I'm already hippie for her, like it's not like she hasn't drank the Kool-Aid yet. Do you know what I mean? Like, and I think you have to go through that, like simply her being sick the last 6 weeks. She's had to recognize how her choices are impacting her health. Just the same way that you couldn't tell your wife, like, you're right there. You're almost, like she had to get it. And my daughter, on her drive home from this camping trip, one of the parents had to bring her home. She's like, Mom, I'm not eating sugar anymore. She's like, she ate a ton the night before she got sick. And then her body went down. It crippled her. And she got to see the experience of that. So the egg thing is interesting because we've been eating like the best eggs for fucking, we don't even buy store-bought eggs. The yolks are orange. It's like, and to some degree, I think it's been fine until it wasn't. And it could be a combination of all the shit she's been eating that normal adolescents are going to eat. and that has created some gut issues. And eggs are a very high allergen food, and they are connected. I don't know if you're into the medical medium. He's like, eggs are horrible. They feed Epstein-Barr. Like, he's like really anti-egg. And it didn't meet my philosophy. Like, I'm very much into ancestral foods, and eggs are a big part of that. But she didn't like eggs as a kid. Like, there was a period of time where she's just like, I don't want to see another egg. And then she started eating more of them later. And I think that's when the allergy sensitivity started happening. So I think it's a combination of leaky gut and like eggs being a very high allergen food. She is craving. She's like, I need pate. Do you have any sauerkraut, Mom? Like, right now in her healing process, which she's in, she's very much craving the ancestral foods, not the eggs, because she can see, she knows her body's reacting. So it's just an interesting process, right? It's not linear, right? We're all in the labyrinth of experience. And for her, she's in this compromised state that is largely a result of some of the behaviors and foods that she's been eating over the last few months. So I think it's great. I got to go home and be with her, though. This morning, she's like, can I have some meat stock? I'm like, yeah, got you.
Well, thank you. Thank you for being on.
Oh, this is so fun.
Yeah, that was really cool.
Oh, good.
Yeah, I really like the not driving yourself crazy, because that can also harm you.
Yeah.
And I also really like the breastfeeding, vaginal birth, and antibiotic.
Yeah.
I think that needs a lot more awareness.
It really does. Yeah. And I think we need to change how these things are handled in the hospital.
Yeah.
You know, we need to individualize care in Western medicine. We must.
Thank you.
Thank you. This was fun.